Wow.
Amazing. I've been sweeping digital corners of my life.
That's important to do. I mean, a lot of people I know do spring cleaning, but I think it makes a lot of sense to do it at the beginning of the year, the end of the previous year, to kind of like not carry detritus of any sort with you into the new era of your existence. Thanks, Taylor Swift, for making just something like every 2 years can be considered an era. Speaking of redefinitions, you like what I'm doing there?
They're getting shorter and shorter, aren't they?
They are, yeah, yeah. Instead of it being like an epoch stretching, a few generations, uh, now it's just like until my next album come out. Now it's an era. I'm in my era now. I'm in my epoch. Sorry,
Well,
Swifties. Yep. Anything to do to irritate a Swiftie. I have a Taylor Swift magazine literally right under my left hand right now, so that's why. Taylor Swift cooks. Quick and easy dishes in the kitchen. 40 plus delicious recipes. Congratulations, Taylor Swift. What can't she do?
well, my stepdaughter's attention has slightly waned from Taylor Swift because I showed her The Greatest Showman, which,
Yeah,
aside from the arguable whitewashing of good old P.T. Barnum, I think is a delightful movie.
it is good.
And we started on Back to the Future, so we've been really getting into some, well, Greatest Showman may be a new classic. Back to the Future, obviously a classic,
Yeah.
a totally classic, because they're
Hey,
totally
I
classic.
think I would consider it totally classic, just like the name of this show, with myself, Brendan McNamara.
And myself, Andy Swindler, a name conceived in our wayward youth as college roommates.
Yeah, it's been around a long time, folks. And I think we tried to make it catch on, even as like a worldwide vernacular. And I don't know how far it got. I never know. I
It
never
was
know with slanguage that you launch into the world.
it was pre-hashtag. I think if we had
Yes.
come of age with hashtags, it would have totally.
Yeah. Yes. Although I have noticed since our moment of origination, um, the the much more quotidian use of the word classic, meaning a much more liberal application. Whereas I feel like classic for a long time could be semi-personal, but it almost inclined towards something canonical. Like a Christmas classic could be It's a Wonderful Life, but a Christmas classic could not be Elf, simply by virtue of like the extra number of 2 to 3 generations, who had absorbed that. You're like, okay, now it can be now it can be deemed classic. And
But
now
Back to the
people are kind
Future
of
came
just,
out 40 years ago.
I know, I know.
You know, we still don't have real hoverboards. We have these fake hoverboards. Talk about
Yeah,
mixing up language.
I know. Talk about using like that's an abuse of language. Yeah, don't call something that isn't the hoverboard that at least our generation longed uh, for quite some time. Don't
Yeah,
call it that.
unless those wheels fold under and lift you into the sky.
Yeah, then does no misuse of language, or innovative use, which gets us back to our topic at hand from part one now into part two. Is gender affirming care ethical? And we concluded, and I wouldn't even say concluded, but we put a pause or a series of verbal ellipses on the plate, mixed metaphor. And our last conversation, I think we're sort of getting near the end of just defining terms, which in this case is not merely just going, oh, is that what we mean? Yes. I think the definition of terms is a huge part of the cultural schism that we have all witnessed and witnessed, especially, I think, to not a special, but perhaps like a renewed cross-cultural dominance of conversation via the most recent presidential election and the Supreme Court case, which has been heard or tried, but I think it always takes like 2, 3 months or something like that, for sometimes even longer, I guess, for like Supreme Court decisions to come out, which I think is a very strange process. But
I'd like to know more
I didn't,
about the process.
yeah, I didn't invent that one. And so jumping back in to the fray of this interrogation, this curiosity, this question, we I want to like start by summarizing kind of where we're at without having to, of course, run the entire conversation all the way through again. And Andy, offline, you had a good, I think, launch question, which I will launch back to you. Uh, is it valuable to have two distinct terms in the first place? Because we talked about gender and sex being synonymous throughout the use of in the English language since around the 1400s, and even I would say modern day consensus. Uh, One, do we need two distinct terms? One meaning biological form, and the second being internal sense. Is it valuable, or what would be the value of that? Let's say it's almost stepping back, really, in a way of like not talking about what these words mean, even. But wait a second. So if one is a novel, it seems to have an inherent like confession of the novel towards the novel proposition idea. And a novel proposition for language is always like, okay, can it mean this new thing? Should it mean this new thing? Or is this new meaning simply incorrect? A la the literally example we've used over and over again. So then this is a sort of questioning of like, well, do we need, is it helpful to have a second term that means internal sense? Sort of summarizing in my own brain, like how that question sort of lays out as a tarp. But how would you answer the question that you began to frame?
Yeah, it seems valuable to zoom out in this thought exercise. I am an emphatic yes. There's value to having two distinct terms, and I conclude that that's why I didn't really hesitate. In addition to just my general progressive stance, and especially at that time, I was so deeply embedded in sort of progressive new thought patterns, new language patterns. Even recognizing now that I think some of that was rooted in this desire to be like in that novelty. It's like, oh great, I get to be one of the right ones, right?
Yeah, early adopter. Yeah,
Early adopter, yeah, that kind
yeah,
of feeling of like, these people figured it out, cool. Like I want to jump on that wagon.
yeah,
uh, and this whole discussion over years between us and in other categories has really revealed my tendency or willingness to adopt new language on a number of issues. So that's just been,
yeah,
I think that's been one virtue of the exploration between us. Specifically for this, yes, I think there's value to it, because I believe it is important to, as you stand for, like define our biology and
yeah,
as a characteristic, as we would do in any species, really, as a
yeah,
biologist would do. It's
yeah.
just
It's
like
just categorization. Yeah, it's
it's
just
a categorization, it's a
yeah,
characterization, and um, something I do still believe in is that it's valuable for us to kind of break free of the bonds of how the categories have defined our socialization and even who gets power over the last several centuries in particular. So in that way, and yeah, I mean, one way where I'd certainly lean into the what's called like the pro-trans argument is that I don't know how important it is a lot of the time to refer to that biology. I agree with
hmm
you that it's important to recognize that as an objective fact.
yeah, yeah,
And it's funny. Like the other day, I went to the urgent care because I cut my finger, and on the form, it said sex assigned at birth,
yeah.
and then it only said male and female. And so that's, I don't mean to jump into that. I'm cheating a little bit because we're trying not to like go to these terms. And then, but what was interesting was your comment back was like, well, why are they even asking about that for a thing like a cut? Because a cut would not be, it would not matter whatever language we want to use. It would not matter like my sexual biology in terms of treating that kind of wound. Is at least how I
Yes,
interpreted
yeah,
your comment.
yeah. And in
Um,
general, well, and to me, it's just it's an inconsistent application of the concept, which that diagnosis is now assignation. Now it's been that way. It's not. It's gaining popularity as a phrase more recently, but it's not like uh, assignation of sex has been. Like it's been casually used. It's never really meant anything previously. But now that
Well,
it's distinct, no one even says it doesn't say like what weight do you identify? Like, you know what I mean? What weight were you assigned by
yeah.
the scale? What
What
height
else would happen?
were you assigned by the ruler?
It's like doing astrology or human design, where it's like, well, where were you born and what time was it? And
Yeah, exactly. Yeah, yeah.
no, and that's interesting. But so that actually is an argument for me why it would be useful to have two clear terms.
Yeah.
So we don't have to keep piling on these kind of bizarre like addendums
Yeah.
to the term, especially in a medical context, where
Yes.
I would argue like yes, in this case it didn't really matter like what sex I was, and I think sometimes it does certainly matter what sex you are when you're having medical treatment.
Yeah, yeah. And it really would never, I mean, sex in that case, it would be gender or sex assigned at birth. That would be a continued what is it? Synonymous usage. You could use either one in that case. Because they're
So on the
both.
other hand,
Yeah.
I also believe that it's valuable because I believe in the fluidity of gender expression, uh, that it's valuable to have a term to specifically mean that the internal sense uh,
Yeah.
of like what gender I am, whether I think as many people believe like truly they are that gender,
Yeah.
or they might even say sex, or at least the outward expression of it. And so we spoke. I think one place we landed in the last episode was talking about gender identity as a possible expression
Yeah.
of that you actually
Yeah.
thought, well, that's potentially accurate
Yeah.
and okay and more clear and helpful.
Yeah.
Um,
Slightly more cool. Well, and it's just the one that's evidence. That's the thing with the idea of like gender being an innate sense of self. It doesn't, there's no evidence for it. It's a flat earth style theory where there's a bunch of people who believe it, but there's no, all the evidence points the opposite direction. Meaning even Merriam-Webster, right, which is like the most progressive dictionary that we commonly use. It's like as far as I understand, it's like something that became haute couture in academia, and then now people have just been saying it at colleges for 20 years or whatever. We actually, when we went to school, I I used the term in a very similar fashion. I wrote I think I might have mentioned this in another show, maybe didn't. I wrote a review about Girl Fight, and my opening line was violence is the key to unlocking the repetitions that comprise gender. So I was being taught that term in that sense, meaning like now, even at the time, there was nothing in the ether in whatever 2000 of that being alterable. I just mean like as this boxer woman is locked into the expectations of added to her gender, the sort of social expectations. Um, but I guess my sense, yeah, the question is, I think there would be a good use of that term, or there'd be some utility for that term, some value to it. But I think it's a limited value, like it's a niche concept or a niche term. And of course, we know that statistically that we are talking about like uh, a relatively small number of identifying persons, less than 1%, I believe. Um,
well, and
Although
that's
maybe
just
higher. Yeah.
the point of language, right? Is that we all might have something to agree upon, some definitions to agree upon, which I
Yeah.
assume is what leads you to being conservative about it, because it's like, well, we've agreed on this for a long time.
Yes.
Some
Yeah.
would
And
argue like, oh, but it's harmful language, and like, well, that's a whole category that we could walk down. And it's like,
yeah.
well,
Yeah.
maybe
Yeah.
another sub question is like, is it more harmful to keep language that we might argue has caused harm in the past, or is it more harmful to just fairly arbitrarily just declare like new language,
New language, yeah. Well, and I think to me it just doesn't seem considered. It felt arbitrary, and I think we're all watching how like this is why we're talking about it in society at large. Is you're like, well, wait a second, you've proposed I mean, it's at the Supreme Court level now, where people and then people at the Supreme Court are testifying that gender means like one's innate sense of one's essential biological sex and how one performs based on that fact. And I was like, so in some ways, now I don't understand how that can't be perjury, but I guess you're allowed to just express opinion as though it's fact. But we're in that place now, and we're at this like social tension place where it becomes a what is it, a wedge or whatever that you can use to drive between people and drive. votes and differences and othering. And I was like, so had we just simply agreed on, remained in agreement, there would be no division. So if you look at it from a social sense in terms of social cohesion, it's destructive to social cohesion. And because there's the downstream of it is all these like, viral moments that we've all witnessed or whatever, where some ask questioning someone's identification, self-identification is called phobic or hateful. And then you have all these like boy something means a different thing now to a whole bunch of people, and girl means something different, man means something different, woman means something different. The famous whatever Supreme Court judge uh, was like, can you define a woman? And she said, I'm not a biologist. I mean, for anybody over 25, that was, I mean, some people in the mix might like kind of understand what was game was being played there, but I imagined, uh, I imagine just like people are, let's say our parents' age or whatever, or older, watching that, they would be like, "Oh, this woman, she has a screw loose." Like that's not a stable thing to say because it's like, well, wait a second, you've answered a whole bunch of other questions that don't. You're not a semantic linguist, but you've been able to define other terms. It's like you're a law expert, but you're talking about many other things. You talk about your personal history. Are you an expert in your personal history? Are you certified? Do you have a degree? Um, so it's kind of led to like I think quite a lot of chaos and maelstrom, which I enjoy. So I'm excited. I think there's social benefit to that because it makes us all have to jump in and go, wait a second, what are we doing here? So then the question is like, who does it benefit in terms of if it's valuable? Who gains the value? Like, let's say of like if we just started using sex only for biological form and using gender for an internal sense of what is it? I guess of like of one's adherence to, I think this is it. It's a really complicated idea. One's internal sense of adherence to social norms around biological sex cohorts. I think is that like probably the most central definition. I mean, I think at this point, I would say it's not valuable to people who believe they're another like they're literally another gender in the conventional sense, meaning they're like, I am a woman, but they're a man. Like, I think that would be profoundly, I don't think that's valuable or helpful. I think it's contrary, but we can get into that when we talk about care, I guess. But yeah, that's what my thing is like, well, who does it? What does it benefit? Like, do we have evidence of gender and sex like as language somehow being harmful in any way? Or really it's just the categorization of it, wouldn't even matter what the words are. It's you're the one who pumps babies out, and we're the ones who don't. We're the ones who put babies in you. If we didn't have words for those things, then there certainly have been people who've used that to as a like organizational principle for oppression. But we're also watching people use gender identity absolutely as a tool of oppression, where people can be fired for disagreeing with it and censored and blah 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 blah. So it's like it's not, at least so far, it's not avoiding oppression. And oh, and this is important, and this sort of ties in a little bit of the history. The history of the term gender identity, at least one of the primary coiners of it, was Dr. John Money, who we've talked about in this program previously. But go ahead and look him up, y'all. You can look up Dr. John Money controversy. And he coined the term and applied it to this, that it could be a malleable thing. And he raised twins, one as a boy and raised one as a quote unquote as a boy and one as a girl. He also had them engage in sort of not simulated, filmed sex play in their childhood. So he did this in order to make one boy act like a girl and one boy act like a boy. And then because there was like there was actually like a genital mutilation. I think it was like a botched, it was a botched surgery, I think, or something like that. Anyway, I'm skimming through, but he filmed child porn with these kids. And then eventually they grew up and they both blew their brains out. So the term gender identity, as far as we know, at least tenably, uh, was partially invented so a guy could do child porn with children. Now, maybe he had positive hopes for that child porn, but he filmed child porn with kids, sexually abused them until they killed themselves. So at least as a start, it's hard to assume intention for benefit based on that.
But
You
that's
know,
gender identity.
yeah. This
Okay.
whole idea of a gender identity, this concept and the term itself. It was him and I believe one other person kind of like, those moments of synergy where people are like, "Ooh, what if?" But since
Well,
he was like distinctly one, like if you just look him up, it'll credit him as the inventor of said term.
well, part of how I'll answer that question of who gains value is um, maybe with another question about, I don't know if it's not exactly harm, but it might. I feel like sometimes these discussions about vocabulary can be distracting.
Mm,
Um, I'm here for it because I think I find value in it, and I think there's not enough rigorous discussion being had about it. It kind of seems often like it's, well, you're on one side or the other, and that's that. And people have to
yeah.
be hardened about it. So I
Yeah.
enjoy the exploration with you. So I would find value in if we could just agree on some of the terminology. And
Yeah.
and I guess I assume you might agree with that too, because that's kind of your whole stance is like, well, let's actually agree on it and stop changing it all the time. But let's
Yeah.
also have
Well, the thing is,
meaningful agreement
yeah,
on these
I
terms.
think, yeah, I think we as a species and we as a country do agree on it. Like, I think it's absolutely a revolutionary minority opinion that gender means anything other than what we still commonly use it for all the time. So it's a radical minority, which is, listen, that's how beneficial and whatever maladaptive revolutions have been launched, are small groups of people standing up and going, no, this is not the way. Um, but it is literally everyone agreed, like quote unquote, everyone agreed on it already. So we were in agreement. So now we've based, and that's why I bring it back to vocab so often. It's A, because I think it's so important to just go and start, go, okay, well, here who's someone who did it, coined it, at least in part, it seems, in order to do nefarious things. We know that as a fact, right? Dr. John Money, who coined the terms gender identity and gender role, and pioneer of sexual identity, the pioneer in the studies of NBC News in the 50s and 60s. Um, so we know why it was started. We know that people disagree with it vehemently. So we're doing something, anybody who uses gender to mean an innate sense is deliberately being provocative, like of culture at large. And it's working, right? I mean, in some ways, it's one of the more effective, I think, revolutions in language, like of my lifetime. And to me, part of the problem is I feel like there was too many revolutions launched at the same time. It's a little of that it's January 6th or whatever, the actual like day's event. There's like 27 reasons, or Occupy Wall Street. There's like 27 reasons why people are there. And so likewise, if you launch this, like, we're going to redefine racism, we're going to redefine white supremacy, we're going to redefine gender, we're going to redefine sex, we're going to redefine boy, girl, woman, man. I mean, it's definitely like we've got to tear it down to brass to tear it down to the stones. So then my question would be, if agreement is important, because I think it is, then it would have to be so overwhelmingly important to create disagreement and discord. I clap when I start. So yeah, so I do think we both want to get the sense of like, well, because we're looking for some sort of social cohesion always, which is like, let's find the commonality points. Let's find the way we can, how far can we at least all walk together? I think it's something we're both like fond of. So then that's sort of my question is, if social cohesion is important, then reducing or destroying that cohesion, especially on the realm of what gender is, because we have evidence of consensus in the Oxford, in Merriam-Webster, in whatever. It's beyond the shadow of a doubt. There's literally no doubt that these terms are synonymous throughout all of English language history. So you're introducing a revolution, including some lies, and based on like pedophilia and suicide, then like how do we start to think that that was intended to provoke value? I guess that's my sense. It's like I would be skeptical. Now, can it create value? Yes, right. That possibility has to exist, but I'm very skeptical as to that being likely. Simply because you're like, well, look how it started. It would be like, can the Nazi form of government yield benefit? I'm sure it can. I'm sure someone can come along and do a version of Nazism that works. I'm not going to give them the benefit of the doubt that it's going to work or that it's not like something we need to regard skeptically. And it's going to sow division if they use that terminology or in that sort of semi pseudo fascist construct. So yeah, that's where my brain goes in terms of value. And I'm like, well, do we have evidence? Do we have evidence of value, or do we have evidence to contradict the introduction of harm? Intentional, I mean.
Well, we kind of drifted into back into the definitions. So just to be really clear, like
Yeah.
for you to answer the same question I did more abstractly, like, do you like leaving aside the history of the word gender identity or
Yeah.
any of that, do you think there's any value to having two distinct terms, one for biology and one for internal sense?
Uh, Not really. I mean, maybe in science fiction or fantasy, because it's not real. So then there are, I mean, it's fun. I mean, it's fun to come up, a everyone knows what a hyperdrive is. Um, doesn't exist. Uh, so in that way, it's certainly helpful or be helpful to be like, uh, if one could, what was it called? Ancillary justice. There was a ship that basically could live its sort of central programming, intelligent AI sort of ness lived in all of these subordinates. So it lived in the ship itself, controlled the ship, and then it controlled everybody who officially worked on the ship, essentially, and it was from enslaved people and captured people and indentured servants, blah blah blah, and it would just take over pretty much wipe their central core of humanity of like and basically run those people as itself. So it had hundreds and hundreds or thousands of selves as well as running the ship itself. But at some point, like of course, disaster strikes, and then just one of those entities who was like a living ship we don't even know what he or she looks like because they flip pronouns around, but I think essentially it was a woman. But it's a woman's body, but inside it was literally a ship. So we can't, you were like, well, so its internal sense of self would probably be whatever it was programmed to be, or let's say an it. So in that case, yes, I think it would be a helpful term in terms of literary usage. I don't know that it's helpful outside of the clinical or in terms of gender dysphoric. We have gender dysphoric in terms of describing the incongruent concept. But because then it's essentially still relativizing that which is objective, like an innate sense of one's.
Well, like I perceive that term as at least negatively tinged. I mean, dysphoria.
Yeah. Well, it is negatively tinged because it's incongruent with reality, like
Well,
like
so
like anorexia or whatever.
then what would be it's interesting having this conversation with you on many levels, one of which is
Yeah.
you dress rather flamboyantly sometimes and
I'm
extravagant.
wearing a women's sweater right now.
So one might see you on the street and say, "Wow,
Yeah.
that dude's dressing like a woman."
Oh yeah, yeah.
So you're no stranger to the idea of pretty radical self-expression. Um,
Oh, I think it's so fun. Yeah.
and yet you see no need to like recategorize that self-expression. You're just like, well, this is me dressing however the hell I want to dress.
Yeah. It's play. It would be defining play as reality, which is just like so it's contradiction. It's a contrary concept to human history, anthropological history, social sciences, human history. Literally, it's an attempt to like it is a fundamental ground floor up beyond social organization, a revolution attempt. And I'm just like, well, I like revolutions. I like that idea. I mean, literally, I'm a Christian, which is like an upside down, whatever, commonly within referred as the upside down kingdom. But I was like, here, I don't see the utility and I see a lot of the harm. Meaning, so then I was just like, no, there doesn't really need to be do you, I don't know if I don't want to give anybody language to then like embrace something um, that's harming them because that would go into the ethical care or care and ethics. So it would not be careful or ethical for me to like, oh yeah, we definitely should have a term for like anorexics, whatever. To me, that's we've used that in text and stuff. That's the closest equivalent to gender dysphoria that I can kind of see in terms of suicidal ideation problems, anxiety, comorbidity, psychologically, as well as like believing something firmly to be true that all evidence points to not being true. So it's like it's a form of schizophrenia. So then I was like, I don't know if we want a socially, quote unquote, socially acceptable term like when anorexics were going by Annas or whatever for a while in the online when it kind of blew up in the what was that like the mid 2000s where there's kind of a social contagion around anorexia. And I was like, I don't know if I like that. Like I like inventing words, but I was like, I don't think that's helpful for you to start like positively identifying with the fact that you firmly believe you're something that you're not. So I guess to
And
me, that's
and
probably why I
truth,
question the value overall.
right? And so, I mean, that's important, right? Because you're anchoring truth in the objective reality of biological sex, as I'm preferring that term.
Yeah.
Um, and I, as we've discussed on many occasions, being a much, I think, more of a relativist
Yeah.
philosophically, um, so deeply appreciate the truth of personal expression, you know.
Yeah.
So maybe this is actually deeper in the sense of, gosh, we're actually tinkering with different definitions of truth here, or different focal points of truth, right? Objective, observable biological reality, and
Yeah.
the truth of one's own personal expression and how they choose
Yeah.
to
Well, what it
convey
can't,
themselves. Yeah.
yes. Well, but then that's a novel proposition of what truth means, because truth literally means that which corresponds to reality. You know what I mean? So that's what I mean. This is the thing. Once you start relativizing one term, now I know you're a relativist. You're like, what do you mean? Whatever. It's as long as you're communicating and people know what you mean,
I
we're
mean, once you
good.
get 5D about it, man, I mean,
Yeah. We're like,
what
what
is
is
objective reality?
yeah, what is anything, man? But that's fine. But then planes are going to fall out of the sky, and then our children are going to drink bleach, and then you know what I mean. If nothing, again, if everything's just like whatever, whatever, then we can't socially organize. We certainly can't socially revolt. We can't form villages. You have to have, and then at that point, you only form villages off of relativistic authority, which is, as I think we've all seen in history, is the worst. It's the worst because that's when people literally well, it's the worst and the best, right? If you have theoretically, if you have a benevolent despot, then you have a
Because they're just
fantastic
making up
society.
like whatever their truth is of the day. It's
Yep,
like
and that's
watching my stepdaughter make up rules to the game we're playing, right?
yes. And you're like, I thought you said yeah, but no, but when I have two cards that are -2, then I can. You're like, wait a second, wait a second. You're very crafty, young one.
Well,
But yeah, but in terms of because a lot of what we're talking about is then medical care, right? You, I don't think anyone's allowed. I don't think it's safe at all or valuable at all to relativize medical care into the point where you're like, well, no, it's just kind of like. And so in this case, when you're talking about gender affirming care, you're affirming a novel sense of gender that's contradicted in truth since that claim does connect to biological reality, it's a claim about the word that you're even saying that's not rooted in evidenced, like clearly evidenced winning argument truth about your body that's clearly evidenced to the contrary is not it's not objectively accurate. So that already seems, and then you're trying to then how would you prove care? You can't just assign things or again, but we've seen this a lot. People do it. Here, you have to wear a mask. Why is it? Does he have evidence that it's helpful? Sure, here's some over here, and you're a jerk if you don't do it. So we've watched this, right? We watched people basically be like, "Do you want a trans kid or a dead kid?" Dead kid, pretty quick once this became a public conversation. So you
well,
have people
also,
bullying to push it too.
here's a question. I don't know if you researched this. This would probably be easy to find at least some blogs about.
Yeah,
I don't know. Actually, I've never talked to any trans male friend about this.
yeah.
It's funny I said male because I sort of hold man and woman as different from, to me, male and female is more like on in the sex pillar of like biology, whereas
Mm,
male is more like
yeah,
gender.
yeah,
Um, anywho, but does a trans man, biological sex, female,
yeah.
see a gynecologist?
That
Or
would be that would not be helpful. I mean, listen, they could go to a gynecologist who's trained in non-vaginas,
I
but you're
mean,
just, it's
so
more of a,
by trans man, I mean like a
a female. Yeah,
female
okay. Oh, okay.
who
Got you.
is declared the gender of trans man.
I mean, that's where they should go. Now, if they sew up, even if they've sewed their vagina up essentially and put like a thing on top of it, like a lump of flesh on top of it, like a fake penis, then I don't know. I don't know. I'd have to know. I'd have to know if there's physical access there. You can still examine if, unless they had their ovaries removed, there's still obviously like internal gynecological health that could be addressed. But I don't know if you would, because in some ways, again, if a medical professional's obligation is to provide you care, and you're persisting in, I know plenty of doctors who, if they're, I've heard, I don't know, easily like 30 or 40 anecdotes of doctors who stopped treating patients or patients' entire families just because they didn't get vaccinated with the COVID vaccines. So if the patient you had like literally had their vagina sewed up and was on drugs to sort of atrophy their their uterus and their change their uterus lining, and then they were constantly just like working against care of anything that produced like beneficial physical outcome. I I think you'd be hard pressed to be able to do that hippocratically, right? Like if your part of your oath is to do no harm, then I don't know if you. It depends how deep into the cosplay that person has gone.
Well, so let's we've moved into care, which I know was part of our intention was to
Yeah,
actually um, move into that definition.
yeah,
Well, I did think of a definition of care,
yeah.
and I'm curious what yours are. Thinking you might have your own, plus you've probably done more research than me in terms of dictionaries. Um, what comes to me is that care are actions that contribute to the health and flourishing of a person.
Yeah, I think so. I mean, to me, care, and we've talked about this a little bit already, I think last episode, but like care and love, um, I think are actually very similar. Um, in that, yeah, it's the love to me is the will, like desire, willing and working towards the benefit, like the ultimate benefit, the highest benefit of another. Meaning that's like that's your jam, man. Um, yeah, care in terms of a medical usage, I think means, yeah, to produce oh, here we go. I'm just going to do Cambridge Dictionary version. It's pretty good. The process of protecting someone or something and providing what that person or thing needs. Da, da, da. And then needs obviously becomes the reason I highlighted emphasis mine. Needs becomes the area of constant dispute.
Right.
I
Right.
was just talking about that with my kids the other day, who my daughter said, I hate plastic surgery. They're like, why did they even do it? Why did they even invent it? Um, and I'm very glad to hear any young woman say that. And I celebrate anyone else to say it as loudly and as often as possible in public or in private. But I did explain that I was like, well, I assume most of the techniques came from people experiencing like massive disfigurement by result of accident or who
Right.
knows, maybe even birth
Lots of
anomaly.
reconstruction. Yeah.
Yeah, lots of, so it's like, oh, they literally couldn't breathe through their nose anymore. So their oxygen, you're able to measure the oxygen in your blood and be like, you are getting 40% of the amount of oxygen that you need, which means for the rest of your life, unless we can fix this thing in your septum or whatever, then you're just going to be exhausted. You're going to basically have a chronic fatigue life, and we can alter it with by these means. Um, so that would be like at least an example of something arguably necessary. And we have, of course, the difficulty in our language where medically necessary is actually like, as far as I'm aware, is an insurance term. It's not actually, you'll see it in the news a lot. And you're like, well, it was medically necessary. They had to do it. No, that's not exactly what that term doesn't always mean that. Isn't that fun? Isn't that helpful? I don't think it's helpful. Medically necessary just means it's something that insurance would pay for. So it doesn't have to be necessary. It could be an elective. An elective is not necessary. By definition, those are like separate categories. So
Right.
any treatment for gender dysphoria that involved affirmation would couldn't be care ultimately because you'd have to prove need, and I don't think you can prove need subjectively, as far as I'm aware. I could be wrong, but yeah, but I think care essentially, I think care for both of us would be very similar things.
Right. That's fascinating. Need is, you know, I guess many of us could agree on some objective physical needs,
Yeah, water.
water and whatnot, but we also live in an incredibly toxic and unhealthy society. So it's like, how many of us are really getting what we need in that way to begin
Yeah,
with? So,
yeah,
and then there's a much more subjective definition of need in terms of psychological health and what does somebody need
yeah.
to be
Yeah, yeah.
healthy,
And you have a kid too. So like one of the hugest things is to teach your children the difference between those terms, what you want and what you need.
right?
And if I try sometimes, you might find you get what you need.
Oh, there it is, folks.
There we go. And then so wait, what's that? Is that at least all the terms? Oh, affirming. I think would we both affirm that affirm means to push in the direction of agreement?
It's a yes and.
Yes. Yeah. And then is it ethical? Do we both essentially, I thought we might, but maybe we don't. I thought we might essentially agree that ethics is essentially a system of morals or values, a set or system of moral principles, especially ones relating to a or affirming a specified group, field, or form of conduct.
Yeah,
So does it fit within a set? I think that's an interesting aspect of the definition, right? The set of,
right.
which means it's not inherently modifiable once you have the like it is about pronouncing a set, meaning like you have to be ethically consistent, really, by definition.
What was the second part? Especially,
A set, oh, especially ones relating to or affirming a specified group, field, or form of conduct. So it really is related to affirmation, which is fascinating, right?
yeah, I'm glad we defined that first.
That's the noun. The adjective is relating to moral principles or the branch of knowledge dealing with these. So the study of moral principles, essentially.
And what and which dictionary is that?
This was, I think it's the New Oxford American. Also, the moral correctness of specified conduct. That might be the closest to what we're talking about here. Uh, moral principles that govern a person's behavior or the conducting of an activity. So medical ethics, quote unquote, medical ethics also entered into the question. Or many scientists question the ethics of cruel experiments. I think that
It's funny to me because what's implicit to me in that is the outcome or the impact ultimately. But
yeah,
it's not
yeah,
named really in any of those. I mean, I think it's kind of implied. It's like, well, you have these principles and this conduct that's socially, acceptable or that govern a person's behavior, but it's like to what end? To me,
it
that's
could
the
be,
question, right?
yeah,
Ethics, hopefully, maybe these connect in the sense that, well, hopefully
yes.
ethical behavior leads to care and love. Maybe that's a premise we both hold.
Yes, yes. So it can be ethical. I mean, ultimately, the answer to the question has to be yes in the purest sense, because an ethic can be a harmful one. You know what I mean?
Right. You're right.
Yeah,
This is a non-judgmental definition. I'm adding judgment
yeah,
to it, like by
yeah,
impact. And it's like really not. It's just saying as long as it adheres to that set and that
yeah,
socialization.
yeah. Which could, I theoretically, if you could include hypocrisy in the set, you could possibly get away with violating the set. But it seems at that point you're starting to enter into the realm of you've kind of blurred the definition so much it doesn't exist anymore. But yeah, your ethic could be Machiavellian, right? It's just like whatever gets me. It's basically about what I want and whatever. I know I'm oversimplifying the prince, but like the ends justify the means. The like, if I got what I wanted, what I intended to get, my ethic is anything that gets me what I want, what I desire, what I deem is appropriate for me is is appropriate. So that, from in that frame of ethic, you can widen ethics. Now, I think in terms of the way we're asking the question, I definitely am asking the question is like, is it, I mentioned as a limitation on, is this properly ethical? Like, is this actually a more set of, because here's the other important thing, moral principles. We do have to factor in the existence of the word immoral. Now, of course, then you get to argument into ethics as to which one is which. So But your morality can be immoral. But then at that point, they are immoral principles, a set of immoral principles. But moral can also mean, again, like that sort of positive outcome sense, or in the purest sense, simply a like a credo or a stance or a belief or whatnot.
So the morality would tip more towards
It's like yeah,
the impact,
like benefit.
positive
Yeah,
impact benefit, right?
and one would hope demonstrable. I
Right.
think if it comes to care, care has to be somewhat demonstrable. Because other than that, you're attempting to provide care. You know what I mean? As opposed to care actually providing care,
Right. Hmm.
if that makes sense. I mean, in terms of the way we're using it, as opposed to just like caring as something like you have an intention towards. It would actually be the provision of. Man, did we at least explore? Have we explored what the question or question? Have we questioned the question enough to know what the question is?
Well, it's you didn't say it today, but last time we said it is gender affirming care not only ethical but loving. And based on the
Yes.
last 10 minutes of our discussion, I'd say, wow, I might have radically different answers to those questions.
Yeah.
Yeah. It's
Yeah. Well, yeah, yeah. Well, and again, that my bias, I mean, as you were saying, you're confessing your relativist bias. I have a Christ, a biblical bias for sure in everything, as I've mentioned many times in here. But like one of the you've probably even if you're not a Christian, you've probably heard these passages from uh, 1 Corinthians 13. It's like the most popular like thing to read at a wedding, where it just says all the love things, right? Love is patient, love is kind. It's not easily angered. And one of the things that it says in 1 Corinthians 13:6, it says, love does not rejoice. Sorry, it does not rejoice or delight in evil, but rejoices with the truth or rejoices in the truth. So that's an interesting thing. Like my Christian bias then auto auto sets, and I then have to look at it. It auto sets anything that is untrue as unloving. Whether someone purports to be loving or not is not entirely relevant to something being loving. And in fact, love specifically would require truth. Like it is that is like what love just as much as love is loving being patient and kind, love also has to celebrate the truth primarily. And it can't so then it can't celebrate lies. Or anything that's not true. Or which again, this is why evidence comes in because you're like, well, can you prove it to be untrue? I mean, it's
well,
how
I
we, kind of thing.
wholeheartedly align. I mean, I associate love with truth. I associate peace with truth.
Yeah,
Even in the
yeah,
poem you read at my wedding, that my version of love is, right? Love holds space for truth.
yeah.
I know we danced into it a little, and then we thought, gee, are we really gonna? How long could we possibly spend talking about what truth is? Uh,
Yeah.
but that is a fascinating place to land on the definitional. I think record-setting definitional exposition between us on one of our shows.
I
But
think so
these
too.
are some heavy hitters, right? Because the way we hold truth seems to be at least slightly different, and but we both relate it to love.
Yeah,
Fascinating.
yeah. It's pretty essential. Yeah. And to me, as with anything, it becomes what can you reality is like what can you prove or disprove in order to figure it out like what is even from a relativistic sense or again a non-relativistic sense you have to kind of like make your case and then you have to like be able to effectively refute the contrary in order to really like hold something even as relativistically true,
Yeah.
which is fascinating, which I think we'll get into in part 3, interrogating the question, is gender affirming care ethical, on Totally Classic with Brendan McNamara and my friend.
Andy Swindler. And that's right, part three. This is a first for us here at Totally Classic to have a
It
three-part.
is. It is. I had to ask a question with a hyphenate, man. I feel like hyphenates make everything complicated.
But I'm a big believer in that premise of like, spend at least 90% of your time getting the question right. And then
Yeah,
and then the answer becomes much clearer.
it should make it much more simple. And even in exploring word definitions too, you also like adjacently stumble on like all sorts of revelations of your own attitudes, I think.
Well,
I
I'd
love
love
you.
to. Oh. Jinx.
No, I love you. I care for you.
And I believe in your truth.
Love you, man.
All right. See you soon.
Bye, buddy.